I am Dr. Carey. I am a pediatrician in Ventura, California, and we are talking baby care. Today I'd like to introduce Andrea. Andrea is the mother of Jack, who is now 7 weeks old. Jack has been breastfeeding from birth, but was not gaining weight very well. Welcome.
Hi, how are you?
Very, very well. Thank you for coming. You were breastfeeding Jack, but we were having some trouble gaining weight. And typically with a newborn, a baby will lose 7-8% of their weight during the first week of life and be back at weight by 2 weeks of age. Mm-hmm. That didn't really happen with Jack, did it?
No, he took about 3 weeks to gain back his weight, and by 3 weeks he was back to birth weight. So he was breastfeeding and just not gaining, and when I brought him in to see you, he was just not where he was supposed to be.
And even at 3 weeks of age, by then, the breast milk alone wasn't really sufficient. So.
No, after he got back to birth weight, I continued to supplement because he still appeared to be hungry after breastfeeding, and his diapers were not being wet enough. So I figured I'd continue supplementing him.
So you were breastfeeding, and the weight was not increasing by 2 weeks of age. When did you begin supplementing?
When he was 2.5 weeks.
Mm-hmm.
Yeah.
So if I'm not mistaken, we took a look at him at 2 weeks and decided to go a little bit longer with just the breastfeeding to see how we were gaining.
Right. I think I brought him in on a Thursday, and then we reweighed him again on a Monday, and he was still at the same weight.
Right.
And that's when we started supplementing.
So we went down about 10% by 2 weeks of age. Mm-hmm. Continued with the breastfeeding
right.
to see whether the milk supply would come in. 2.5 weeks of age, we're still not where we want to be.
Right.
And then at that point started to add a little bit more, little bit of formula
exactly.
along with the breastfeeding.
Exactly, yeah.
That must have been very frustrating for you.
Yeah, of course. As a mother, of course, everyone wants to breastfeed and be successful at it and not have to supplement. And, it is a little depressing. You want to be able to provide everything as a mother for your baby, but, sometimes it just doesn't happen.
This wasn't a complete surprise to you because you have another child, JJ, who's 5 years old. And what was your experience with JJ when feeding?
It was a very tough experience. Of course, when he was born, I wanted to breastfeed exclusively, but right off the bat, he was not a good latcher. I had problems with my milk coming in, with my letdown. I ended up feeling like I was pumping around the clock and trying to get him to latch on around the clock. And at one point, I was just like, you know what, let's just give him a bottle. He seems hungry. I don't want my son to be hungry anymore. And he liked the bottle and he took to it well. And we just decided to use formula. I was young. I was 23 years old. So I didn't have a lot of information and resources. So we just went the formula route, and he was fine with that.
Before you went to formula with JJ, mm-hmm. Who gave assistance as far as breastfeeding?
You know what? We really didn't have anyone to give us assistance with breastfeeding, and nor did I know that we had resources that we could have used.
Times changed with the first and the second child,
yep,
didn't it?
Definitely.
Very good. And so now you have Jack, and it must have felt like deja vu all over again. Yeah,
when I was pregnant with Jack, I did a lot more research about breastfeeding and breast milk and its, the nutrients that it provides to the baby. And I really, really wanted to give him that, And, I don't know what I was going to say.
That's okay. So you wanted to continue breastfeeding.
Yes, I wanted to continue.
But you were frustrated because your milk wasn't coming in. Now, outside of the doctor's office, what resources did the hospital provide you with? Did they provide any?
Yes, Community Memorial Hospital. They said that they had free breastfeeding meetings that I could go to. They also gave me information of La Leche League, and each day that I was in the hospital, I had a lactation nurse come by and visit me and see how breastfeeding was going.
And how did that help? How was that experience different than it was with JJ?
It was just, it was completely different. People cared that about breastfeeding, and people wanted me to be successful at it. The regular nurses that I had also, wanted me to be successful and checked my latch and made sure that he was getting enough and made sure he was at the breast enough times a day. So it was completely different.
Did you follow up outside of the hospital again with the lactation specialist?
You know what, I didn't, and I haven't yet. As of right now, the breastfeeding's going a lot better. He's full, he's having his diapers, the supplementing is going great, so I haven't yet. If I do have any other problems in the near future, I definitely will.
And you haven't experienced tremendous soreness or discomfort from all the breastfeeding?
No, I've been fine.
But we were still breastfeeding, and then you're thinking, okay, we're not gaining weight here.
Yeah.
So did you have was the sense of frustration about the same as it was with your first child, or more or less?
It was probably a little less, because I knew I was going to still continue breastfeeding and also give him the calories that he needed. So I wasn't too worried. I wasn't worried about losing my milk supply, because I knew if I continued breastfeeding, it would continue to grow and it wouldn't diminish at all.
What do you think? How do you think things would have, let me rephrase that. If you had gone about thinking about JJ the first time, and what information would have been helpful for you to be encouraged to continue breastfeeding and going that route?
Well, already the main difference that I see between the two boys is that when JJ was Jack's age, he had gotten sick already. Jack has been exposed. My husband has had 2 different separate colds already. Jack has not gotten sick once. So that's definitely the biggest thing that I see. So if I knew that it would help prevent JJ from getting sick more often, I definitely would have tried a lot harder to continue breastfeeding with him.
That would have been a big influence.
That would have been
for
a
you.
huge influence, yeah, if I had known.
And certainly there's no guarantee that a child who's breastfed isn't going to get sick, but there is a lot of immunity protection from breast milk, which is worthwhile and a good reason to continue breastfeeding. But it also shows that what we really had was a calorie issue here. We were not getting enough calories, and by supplementing with formula, you're not taking away from the other protection and nutrients that come with breastfeeding.
Right, yeah.
How long do you feel that you're going to continue with the breastfeeding?
I would like to continue for at least a year. Yeah. At the end of April, I do go back to a full-time job, so I'm going to do as much as I can to either pump and just get him the breast milk that he needs. But at least a year, I would like to continue.
Have you been pumping at this point?
A little bit. A little bit.
How much milk comes out when you pump?
I would say I probably get an ounce out every time I pump.
Okay.
Yeah.
So we're not, now certainly when a baby feeds on a mom, they tend to get a lot more milk than one comes from, because the pumping. Oh, we had one, I still remember, it looked so painful. The mom had inverted nipples and the baby sucked the nipple right out. It just looked like they have a very, very strong pumping. You cannot duplicate that with the contraptions that they have out there.
Not at all, yeah.
And then, are you freezing? Are you able to get enough to refrigerate or freeze, or not much?
Yeah, definitely. I can refrigerate it. I haven't needed to freeze it quite yet, but I definitely refrigerate it.
Okay. Breast milk can typically be refrigerated for about a week, 5 to 7 days, and in a typical freezer for 2, maybe 3 months at the most is recommended for freezing. But it certainly is a good way to stockpile if you can. And oftentimes it's at the 4-month mark when we stop the nighttime feedings that we can do a little bit more pumping at nighttime, when the baby is hopefully sleeping through the nights, and life is wonderful at that point, until 9 months of age when they start moving and life is over at that point. But it's at that point that we can try to hopefully build up a little bit of a stockpile and do that. Did you find any more encouragement from your family or friends about breastfeeding this time around? Yeah,
definitely. I think as the years just pass, people are just becoming more educated about breastfeeding in general and the benefits of it. My parents have both been very encouraging, as well as my husband. They want me to be successful at it, and they see that it's a wonderful thing for Jack to get. So,
did you have any concerns about supplementing?
At first, I did worry about my milk supply, getting a little bit lower, but when I saw that it really wasn't, and after going online and, talking to some of the other women that had the same issues, I was fine with it.
Mm-hmm.
Yeah.
And certainly we hear these terms nipple confusion a lot, which can be a frustrating term because sometimes people apply it to pacifiers, and I really don't feel that a pacifier is going to confuse a baby. They like to suck. It's a natural reflex. It calms them, and you are not a pacifier. Your baby shouldn't be on you constantly.
Yeah.
When a bottle is introduced really early, sometimes the baby is a little more satisfied with that because the flow is so fast that they're saying, oh, this is wonderful. Why do I want to waste my time with that if I'm getting milk so fast? But that's not really what happened here. We introduced it a little bit later.
Yeah, my son definitely prefers to be breastfed as opposed to the bottle, and he does get bottle fed, he gets breastfed, and he has a pacifier. And I haven't had any issues at all with
Excellent.
that. Yeah.
Excellent. And any more children in the future?
We might, yeah. Yeah, we have 2 boys, so we might want to try for a girl.
Okay.
So we shall see.
I have one mom who has 5 boys, and I said, oh, were you disappointed that you didn't get a girl? And she said, you know something? I don't know what I would have done if I got a girl.
That's my kind of thing, too.
Very good. What's the most important advice that you would give to a mom who's having difficulty breastfeeding?
I would just say that every baby is different, and you have to do what feels right for you and your baby. So if they want to eat every hour and a half, they want to eat every hour and a half. There's, no set pattern to babies. They're unpredictable, and each of them are different.
Very, very good. Well, I think that's true. They're not predictable, and you have to go with their own flow, and there might be some reasons why you might have a longer or shorter period of time between feedings, and I certainly don't want to see someone, again, be a pacifier and have their child on them all the time because it becomes very, very uncomfortable because of that. But coming up with a sensible schedule that works for your baby is really what we want. So wonderful, and it's nice to see that we can continue with breastfeeding even though the milk supply had not been where we had wished it to be, and your baby is doing great and gaining weight and everything is wonderful.
Yep.
Perfect. Well, Andrea, thank you so much for coming in.
Of course.
Thanks for joining me in discussing poor weight gain. I am Dr. Carey, and I thank you for watching. For more baby care education and to sign up for our free newsletter, please visit us at drcareys.com. We're at Dr. Carey's, we teach baby care.
Breathe in, breathe out. Breathe in, breathe out. Okay, let me see your ears.